I want to talk to you about congenital heart defects. According to an article in Critical Care Nursing Quarterly, congenital heart disease affects 8 per 1,000 live births, with approximately one-third of those infants needing care within the first 30 days of life. It is the most common life-threatening defect in the first month of life. Today I want to define what a congenital heart defect is, how early detection can help outcome, and how pulse oximetry is helping to detect congenital heart disease in infants. So what is a congenital heart defect? The March of Dimes website explains that a congenital heart defect is when the heart or the vessels near the heart do not develop normally before birth. Congenital means inborn or existing at birth. By the 8th week of life, the heart is nearly developed. As explained in Progress in Cardiovascular Nursing, advances in fetal echocardiography now permit the detection of some heart defects as early as 14 weeks after conception. If a heart defect is detected, additional testing can be completed to determine severity. Research in pediatric nursing shows that the earlier diagnosis allows parents to be better informed in making choices and to prepare them for what could occur at the birth. It also allows cardiologists and pediatric care practitioners to be better prepared at delivery. What do we already know about CHDs? We know that there are 35 known defects. Little is known about what causes them, and there are no cures for any of them. Defects can range in severity from mild, such as a hole between the chambers of the heart, to a severe deformity in which there's a complete absence of one or more valves of the heart. Some children may have multiple defects and require multiple surgeries throughout their lives. Some defects may not be detected at all until a child collapses while playing. Advances in medical treatment have improved survivability. According to Progress in Cardiovascular Nursing, for the first time in history there are more adults living with CHD than children, making it highly likely that these nearly 100 survivors will show up for care at a medical facility that does not know how to meet the needs of their special requirements. This has led to new advancements in medicine and the creation of specialized cardiac care units. I'd now like to introduce you to Cole. Cole is a family friend and a CHD survivor. He was born following a normal pregnancy and delivery. However, at 7 weeks, Cole became ill. His pediatrician diagnosed a previously undetected heart defect. Cole was diagnosed with truncus arteriosus, which an Arts and Science article described as a complex malformation where only one artery arises from the heart, forming the aorta and the pulmonary artery. It states most of these children will require early intervention, and Cole did have his first heart surgery at 3 months of age and has already had 3 additional surgeries, and will be facing the realism that he will need an additional surgery every 6 to 7 years. We know that many of these defects are detected in utero, but what's being done to detect defects in otherwise healthy infants? According to a study in Norway, the first day of life pulse ox screening provides early in-hospital detection of CHDs, and it may reduce the number missed and diagnosed after discharge. Based on this information, many state legislatures are enacting bills which will require pulse oximetry to occur prior to discharge following a birth. As I conclude today, I want to remind you that many children are born with congenital heart defects. With advances in medical science, a greater number each year are surviving into adulthood. Pulse oximetry screening will help improve early detection. Remember, most congenital heart defect kids don't look sick. You can't tell them apart from other kids, yet most of these children have faced more in their young lives than any person should. 1 out of every 125 children are born with a congenital heart defect. What if one of those were yours? Thank you.